Dr. John here with NBC News on this Facebook Live, talking things coronavirus. I'm going to update you on a couple of things that have happened over the last week, but also talk about viewer questions or questions you might have. So please go ahead and forward your questions. We'll get to as many of those as we can, and they tend to normally be fantastic questions. So please make sure you send those so we can go ahead and answer them. But first, let's start off with what's been happening. The biggest news are the reopenings and what that's doing to states across the country. And what we're seeing, especially in some states, is a big upswing in coronavirus cases, a spike in these cases. And the reason this is happening is because people, as some experts have put it, have started to go back to a pre-pandemic level of thinking. In other words, they're going out, they're not necessarily doing those things that we know can really help keep this under control. And the main things that really help keep this under control, I know you've heard this time and time again, but I want to make sure that everybody understands it. Wearing masks, very important. Social distancing, 6 feet or more, is probably the most important thing you can do. Not gathering in large groups, 10 or less is the current recommendation. And washing your hands many times a day, 20 seconds washing your hands, or using alcohol-based hand sanitizer, 60% or more alcohol if you can't get to that sink. And especially before you touch your face, because that's how we get coronavirus. So one of the things we have learned about coronavirus over the last few months is exactly how it gets into our body. We know it's a respiratory virus. These respiratory droplets hang in the air for just a little bit of time before they drop to the ground. That's why that 6 feet is so important. And that's why washing your hands is important too, because even though it's not as likely you're going to get it from contact, in other words, touching a surface, which we call fomites, just because in medicine we like to call things by different names, we call them fomites. You touch a fomite, a surface, touch your face. If the virus is on your hands and you touch your eyes, your nose, or your mouth, then you can get it in your body that way. So that's why that's so important. The social distancing we talked about, the wearing a mask. The main reason you wear a mask is to protect other people from you. Those respiratory droplets, think of it as almost the equivalent of covering up when you cough or sneeze. So instead of coughing and those droplets going out farther, when you cough, it just goes to a certain distance. The distance of the mask might leak through a little bit, but it's still not going to go very far. And that's important because those droplets are a lot smaller than most people think. They're around 5 to 10 microns, which is very, very small. But the virus is 0.125 microns on the average, so extremely small. And that's why those masks can not necessarily protect the virus from going through, but they can protect those respiratory droplets. And the virus typically doesn't go through on its own. It goes through with those droplets. Now, if you're talking, then it might go through a little bit on its own. And if you've ever seen yourself on a cold winter day, you get that mist surrounded when you're talking, that mist, that's how far it can usually travel in that condition. Singing, we know, can make it go further. People yelling, screaming, aggressive talkers can make it go further as well. But that coughing and sneezing is the main thing. And that's why you wear a mask, to protect other people. The best protection you can get, though, is if somebody's wearing a mask and you're wearing a mask, then you're both very well protected with that 6 foot distance. Large groups, again, that's an issue that is of big concern because of the protests that went on these last couple of weeks, people going out and during these reopenings and getting close together with other people. That's how the virus spreads. And so, again, the things you want to talk about, the things you want to do, wear a mask, social distance, 6 feet or more, not gathering in large crowds, and washing your hands plenty of times a day. So now what we're seeing, again, is this upswing of cases. The important thing is to make sure these case spikes don't turn into case outbreaks, because if it does, we're going to be back where we were a couple months ago, and that means some of these reopenings are going to have to close down. We might have to shelter in place again. Not something any of us want to do right now because we've spent months doing that. But a couple things are going to have to happen. One, the public health services, our government, are going to have to step in and make sure that these things are kept under control. But on top of that, we're all going to have to do the same thing. We're all going to have to do our part. And that means, again, those things we just talked about, to try and keep these under control, try and keep these spikes from turning into outbreaks. Extremely important. The other thing I want to talk about is the update on the vaccine. We've heard some news about the vaccine and all these studies that are going about. There's one study that's starting to head towards a phase 3 trial, which is the last trial that's going on, that goes on before they start producing it and giving it to people. But the phase 3 trial hasn't started yet, and it's one of those things that is going to take some time. So the vaccine is close to being here, but it's not here yet. There is the potential it could be here in the fall, particularly the late fall. But more than likely, early winter time frame is when we'll probably see the vaccine. Hopefully, because of all the effort, all the manpower, all the money that's being put into it, we're going to go ahead and see it earlier, because this is a huge, unprecedented effort across the globe to get us a vaccine. And hopefully that pays off and we do get one sooner rather than later. But they want to make sure it's done as safely as possible. One unique thing they're doing here, which Dr. Fauci has talked about a few times, is they've never done this with the vaccine before. Usually what they do is they wait for the vaccine to go through the phase 3 trial. Once it successfully does that, then they apply to the FDA for approval. Once they get FDA approval, then they start the production process. Well, what they're doing here is, as it's going into phase 3, it's gone through phase 2, they're going to go ahead and start production. The government's going to pay for them to start production, which means that somebody somewhere along the line potentially could lose billions of dollars because this vaccine may not work through phase 3. But they want to make sure they jumpstart the process, or else it's going to be even longer, probably a 6-month delay from the end of phase 3 until they start getting the shot out there, because it takes a while to get that production ginned up. What they're hoping is they can look at their best guess as to what's going to work, start producing it. The second phase 3 has been done and approved, they can go ahead and start giving people the shot. They've never done this before. They're hoping it works this time. And my guess is they're going to do this with more than one shot, more than one vaccine, so we can get one vaccine that works. On top of that, we're going to have more than one vaccine that works, at least through phase 3 trials. And so I think you're going to get a variety of different vaccine choices when you go get your vaccine. And it could depend on where you live, could depend on your age, could depend on a lot of factors. But there's not going to be just one vaccine for everybody. There's going to be multiple vaccines and vaccine makers, much like the flu shot right now. So again, the things we've talked about, the reopening, what's happening there, and how we all need to help out to make sure it stays under control. And then the vaccine, it is getting here. And hopefully it gets here sooner rather than later, but we still have a little bit of time to wait before we do get that vaccine. So now let me see if we have any viewer questions.
Dr. John, what about protecting your eyes?
So the question is, what about protecting your eyes? Here's a couple things we know about our eyes. One of the receptors that this virus likes to attach to, and the way it works is it attaches to the receptor on the cell, and then it works its way into the cell. In order to get into the cell, it has to actually attach to that receptor. The receptor it likes is called an ACE2 receptor. We know that's in our kidneys, we know it's in our intestines, but we also have found out it's on the surface of our eyes, and that's how we think it gets into the eyes. Usually gets into the eyes by contact. You touch something, that fomite we talked about, that has virus on it, and then you touch your eyes and the virus gets in that way. Theoretically, it's possible that if you're within 6 feet, somebody coughs or sneezes, that those respiratory droplets could get in your eye as well. Not as likely, because we tend to blink, especially if somebody's coughing or sneezing around us, but theoretically that could happen. So if you want ultimate protection, you want that face mask, you want that social distancing, and you want glasses or goggles potentially. But some experts are saying that might be a little bit too much. You don't necessarily need those. But glasses, if you have sunglasses or prescription glasses you're using, then definitely go ahead and wear those instead of contacts, because that'll help keep the virus from getting in your eyes. But the main thing is to make sure you simply don't touch your eyes or your face until you wash your hands. But it theoretically can get in that way. Mouth, nose, and eyes, and it can get in that way from you touching the eye itself or around the eye and getting in that way. So you have to be extra careful.
How soon after exposure can you get a positive test?
So the question is, how soon after exposure can you get a positive test from the virus? And one of the reasons I think we're getting this question is because of the recommendations from a lot of experts and from a lot of governors as well, and even mayors, saying that if you were involved in protests, you want to look at getting a COVID-19 test. The reason they're saying this is because of the fact that you're in those large group gatherings, and that's the high potential for it to spread that way. Usually 5 to 7 days is the time period it takes to build up enough virus in order for the test to tell you whether you have it or not. Most experts say somewhere 5 to 7. I would probably err on the side of 7 days, saying, okay, I gave it a good chance to build up in my body. Obviously, if you start getting symptoms earlier, that means it probably built up quicker and you can get the test earlier. But if you get it too early, it's going to be negative because the virus hasn't built up enough, and then it could certainly turn positive a few days later. So that 5 to 7 day time period seems to be the one where you're getting the most out of the test and the most likely to detect it if you do have it.
What about a second wave? Will there be one in September or October, but not now?
So the question is, what about a second wave? Will there be one in September, October, but not right now? And that depends on your definition of second wave. most experts are saying, okay, the second wave is after the first wave comes down, we've calmed that curve down, we've gotten down to a level of valley of cases, and then we're going to start the second wave again. They think that'll happen in the fall. What most experts are saying is that we're actually still in our first wave, and these upticks you're seeing are just upticks in that first wave, not necessarily a second wave. And so it's a bit semantics as to which wave is where and when, but what we think is happening now is we're still in the middle of the pandemic. We still haven't really come down. We've come down on the curve in some areas. Other areas we've actually gone up on the curve, but overall we're starting to come down on the curve, but we haven't reached that value yet. And what I think is going to happen is the summer, as opposed to most coronaviruses and the flu and other viruses like this that are winter viruses, this one's going to at least initially be a year-round virus. So this summer, we're going to see a low level of virus activity, of viral activity around the country, around the world, and then it's going to start going up again in the fall once our weather starts cooling off. And that's when we're going to start seeing more activity, and that's where we're going to start seeing what a lot of people are saying as the second wave. The second wave will essentially repeat what happened over the last few months, the first wave, but hopefully not as intense, hopefully more of a flattened curve like we've talked about in the past, and hopefully not as many people being affected. So,
will the flu shot protect you in any way for COVID?
So the question is, will the flu shot protect you in any way from COVID? This is kind of a yes-no answer, because the flu shot itself is not going to give you antibody protection from COVID. But what will happen is, if you have the flu shot and your immune system is primed to fight off the flu, then you're less likely to get the flu or less likely to suffer consequences from the flu. That means that your immune system won't be weakened, and so if coronavirus happens to be around, you won't get it. Theoretically, it's possible you can get two. They think it has happened to some people, but it's very rare to get both at the same time. But what could happen is, if you do get the flu, we know it stuns your immune system for a few weeks afterwards. Your immune system takes time to recover. In that recovery period, coronavirus could move in and attack your body, and you can get coronavirus much easier because your immune system at that point is trying to regenerate itself and so can't fight it off. So even though the flu shot itself will not specifically protect you from coronavirus, the flu shot will keep your immune system as strong as it can during the flu season in order to protect you from getting coronavirus once that starts coming back again in that second wave we were just talking about. So again, it's that yes-no answer.
Are there any long-term health issues with COVID-19 that we know of besides death?
So the question is, are there any long-term health issues besides death with COVID-19 that we know about? It's interesting because what they're finding out is COVID-19, the rehab centers, the centers where people go after they've been in the ICU for a while, are getting overwhelmed right now. This is turning into their own second wave of treating patients because patients are being released from the ICU. They're not doing as well as we would like them to do. And surprisingly, the age is different. These are youngsters. These are 20, 30, 40-year-olds that are being affected by the same things that the elderly people tend to be affected with if they're in the ICU for 2 or 3 weeks. It's called post-ICU syndrome. And what happens there is they tend to have memory issues. They tend to have neurological issues, as in certain limbs might be paralyzed. They have wound issues. They're rehabilitating people there. Long-term wise, they think these long-term issues will be under control, but there still could be some cognitive issues, meaning thinking problems. There still could be some emotional issues, and PTSD is a big problem. Because what we're finding out is that people are coming into the hospital and essentially not remembering what happens after they get to the hospital. And time again, we've heard from people saying, I was sick, somebody took me to the hospital, and next thing I woke up 2 weeks later, have no idea what went on. And so that's causing some issues as well. And so as far as long-term, we don't think there's going to be a lot of long-term issues from that perspective. But if people do get lung problems, then we do know that that can cause long-term issues and long-term lung damage. There was just a double lung transplant just accomplished from somebody who had just that. And that double lung transplant is actually saving their life. And so again, there can be issues with that. Overall, most people still recover from this. Good percentage of people don't even know they have it, but for those that get severely affected, could cause some long-term issues.
You talked about the flu shot and how that can help, but is it better to get our flu shot early because of that? So
the question is it better to get the flu shot early because of coronavirus? And again, we just talked about how the flu shot won't help specifically protect you from coronavirus, but can help keep your immune system strong to fight off coronavirus if it does show up. Now the question is, when should you get your flu shot? Well, the flu shot has started to show up earlier and earlier, August, September timeframe. What most experts say, we're still going with that, is you want to get the flu shot sometime around Halloween. That's probably the best time to get it. If you start noticing coronavirus numbers are cropping up and starting to go up higher and higher, you might want to go ahead and get the flu shot a little bit earlier. It's not going to be available during the summer. It's being produced right now, and so it will become available in August. September is usually the time frame most people start thinking about it. So if you start hearing cases of coronavirus going up, specifically if you start hearing cases of flu starting to show up, then look at getting it earlier, September time frame.
Dr. John, can you talk about noses should be inside your masks?
Okay, and I don't have a mask here to show you, but noses should be inside your mask. And there's 3 ways people wear their masks particularly, and one of them is correct, and that means the mask is over the nose and the mouth. The other way people wear it is they wear it down here around their mouth. I don't get the complete idea behind that. I think they think that that their breath when they're talking, that they can protect other people from that. But at the same time, you have to realize that when you talk, you're also breathing through your nose. It can go out there. If you sneeze, obviously that's not going to protect you at all. And as far as protecting you, you're still getting the respiratory droplets in through your nose if you're too close to somebody. So you want to wear it over there. The other way I see people wearing it is down around their neck or pulling it down to talk to other people. Completely defeats the purpose of wearing the mask. So when you wear the mask, you want to wear it over your nose and your mouth, particularly tighten it around your nose. If you wear glasses and it's fogging glasses, it's not tight enough around your nose to prevent droplets from getting in that way. And again, those masks, we've been shown that they work very, very well. What they found out in Italy is those masks, they think, actually saved 80,000 deaths because of having people use those masks. And that's how important they are. It's not going to give you 100% protection, but it's certainly going to help, and it's better than not having them at all, especially in situations where you can't socially distance. But please, wear them correctly.
Are they able to opt for confidentiality when they're being tested for COVID?
This is actually a very good question. If people are getting tested for COVID, can they opt for confidentiality? There's a built-in confidentiality that we have here in the United States. It's our HIPAA laws that we have here. And that means that if you're a patient, if you're undergoing treatment, then that information cannot be given to anybody other than other healthcare providers or other entities that are taking care of you. The same thing here. So if you're getting tested for COVID-19, let's say you test positive, what happens now is that test has to be reported to whatever public health department you happen to fall in at that time. That public health department is then going to do contact tracing. They're going to trace other people you might have been in contact with, which means they're probably going to call you and say, hey, where were you? Where'd you go? Where'd you travel? Who are you with? All those questions. Once they start doing that, they're going to contact those people. But the way they contact them is they say, you were exposed to somebody who had coronavirus. We need you to quarantine yourself for 14 days. They don't say who it was. They don't say where it was. They just say, this is how it happened. We need you to quarantine yourself. And that's because of our privacy laws and our protections in place. So to a certain extent, your privacy, your information will be told, but it'll be told to other entities and other units that are taking care of you or taking care of the public health implications behind COVID-19, but your specific information, your name, those things should not be given out to anybody else, especially the people they're doing contact tracing with. So you do have protection there from it being leaked or individually given, but overall and given for public health purposes, that still can be done.
When do you think the pandemic ends? Where are we now with regards to that?
So the question is, when do you think the pandemic ends, and where are we in question of that? We talked about this, how essentially we're coming down the bottom of the curve. We're not there yet, and so we're still a ways from this pandemic ending. My guess is this pandemic is going to start the beginning of the end once we get that vaccine. And we talked about how that's going to be in the fall or early winter time frame. That is going to be the game changer behind all of this. What typically happens with pandemics is they're multi-year events. If you look back at the 1918 flu, plague, any of these other pandemics that have occurred around the world, they've been multi-year events, because what happens is over time we start getting herd immunity. We're not even close to herd immunity on this one, because they estimate herd immunity is going to have to be in the 40 to 50% range. Right now we're down to less than 10% of people that have antibodies built up to this, and so we're so far away from that this vaccine is going to become a big player. But one of the things I want to talk about is what's happening with the reopenings right now and how that leads into the pandemic and refueling the pandemic, the cases. Because as we talked about early on, there are these spikes in cases that are happening because of reopening, particularly in other states around the country. One of the reasons this is happening is that pre-pandemic level I was talking about earlier, where people are starting to get behaviors that they had before the pandemic started, not wearing masks, not social distancing, gathering in large groups, those types of things. The one thing to remember is why we are reopening. We are not reopening because the pandemic is over or almost over. Far from it. We're still in the midst of the pandemic. The reason we are reopening is to try and jumpstart our economy because that's desperately needed. But if you talk to people, the big question I get is how can you do one without the other? Well, this is not a binary thing. This is not you either reopen or you take care of the public health issues. This can be done together. And that means that we can reopen, jumpstart an economy, but we can do it safely with the thought in mind that we want to keep the pandemic under control. So we can do both together. And that means what I talked about earlier, our public health entities kicking in to really contact trace, test, quarantine, isolate, those things that we know need to be done to keep it under control. On top of that, our governments, our local, state, federal governments can kick in to try and make sure that everybody has what's needed to get that under control, including any regulations or rules that might come up to start slowing things down a little bit or even regressing in these reopenings to try and make sure these spikes don't turn into outbreaks. And then third, and I think even more importantly, is the things we can all do to keep it under control. And that's those things we talked about. Wear a mask, social distance, don't gather in large groups, wash your hands a lot. And I know it's boring. I know I say this a lot, but it's the 4 things that can really help us keep this under control, especially if you go out and about. If you go to a restaurant, fantastic. Have a great time. But stick with your group that you've been sticking with. Make sure you do the things. Social distance when you're there. If you're at the beach, same thing. Sports, we're probably not going to see huge crowds in sports for a while, but once we do start opening up sports to fans, keep that in mind as well. We can get through this. We will all get through this, but we need to work together to make sure we do it in a healthy fashion and as quickly as possible. So again, the things we talked about, the reopening, which I just reiterated there, and then the vaccine, the race for the vaccine. It's happening faster than it's ever happened before. Keeping our fingers crossed that we do see it in the fall, more likely in the early winter. But it will get here. It will be the game changer. It will help us get our lives back to normal, or at least a new normal. Thanks for watching. Have a great weekend. I'm Dr. John Torres.